Hi, my name is LaJoya Johnson. I am the founder of Black Educated Lesbians. Facebook started as a Facebook group in 2014 and is now a 501c3. We will be having our annual conference, the Black Queer Women's Conference, in September. And I wanted to have this conversation, Our Bodies, Our Truths, to talk about OBGYN biases that we have in the Black queer community. And I have two important, great panelists here that will be discussing the topics and all the things. And I just want them to do a brief introduction, and then we will go ahead and get started with the question. So, who would ever like to go first? Go ahead.
Yes, I'll go. Hi, everyone. My name is Les Henderson, pronouns she, her, they, them. And I founded Gyno Queer, which some of you guys may know as formerly as Endo Queer. I created it after I went through my bouts with endometriosis, which I later found out was thoracic endometriosis, and it led to a few lung collapses where, and through my post care, I went through a lot of bias and different and different experiences. So, and I never wanted anyone to feel as alone as I did during that, during my journey with everything. And I'll say more throughout this panel today.
Yeah, thank you.
Amazing. And good afternoon, everyone. I'm Dr. Shiva. I'm an OBGYN physician. I am a big advocate for women's health, reproductive justice. And that's what actually led me also to found my services, which I offer, which are health coaching within the reproductive health space. I focus on a lot of fibroids and fertility, but the main reason for this service is really to help with education and help with advocacy and to help people know that they have a support system as they are engaging with the healthcare system, which a lot of us know has a lot of holes and pockets in it, which I'm sure we'll be addressing a bit later this afternoon. And I look forward to chatting with you guys more.
Thank you so much, so much. Actually, the reason why I wanted to have this conversation was Les um, told me about her uh, endometriosis, and I had no idea that it could literally affect your lungs. Like I had no idea, and so that made me wanna do this conversation so we can talk about all the things because we do have multiple issues. I personally have uterine fibroids, and everyone loves to say it's due to my weight, but there's a lot of people who have uterine fibroids and they are skinny. So I think that there are so many things that we need to discuss in this conversation, and so let's get started. So the first question that I have is, um, can each one of you share what brought you to this work and how your identity informs the care you provide or advocacy that you lead?
I guess I can get started with that one. So, um, in medical school, I noticed that I was always kind of drawn to women's health. I've been a person who has been very informed of justice and advocacy, in that I always felt drawn to being the person who stands up, not just for myself, but for other people. And within the OBGYN space, it just so happens to be a field where there is ample opportunity to do the work with filling some of those holes. If anyone watches the news lately, we know that reproductive health has been at the forefront of recent politics, but the injustices of reproductive health have been going on since its founding, since the insemination of what we know to be gynecology. And that really drew me to the field. In addition to, of course, providing reproductive health, we are the people who can really change people's lives by improving their quality of life. And that's what really drew me to this space. I think that it's a very unique space with a lot of work to be done. So there's also a lot of opportunities for really making things better for people on a large scale as well. So I'm excited to get more into that too now that I've finished completing my training and getting ready for the next steps with things.
Yes, yes, thank you.
Mhm.
And for me, what really drew me into this work, as I just mentioned, and starting going back to 2016 when I had my first lung collapse. And at that time, I didn't even know, like, I was like you all, I didn't know that endometriosis affected the lungs because about a year prior was when I got my official endometriosis diagnosis. So it was something to even find out, oh, you have thoracic endometriosis. And then from there, unfortunately, as some of you guys may know, I went on to have a few more lung collapses over the next couple of years after that. But it was really the treatment that I would experience, just trying to get care and navigating, everything that's happening to me. And even though now some breakthroughs are being made with about endometriosis and people's ignorance are starting to diminish, however, it still is, a lot of people out there and even medical professionals, unfortunately, that still relates endometriosis to the feminine. So of course me, I identify as a masculine of center woman, and you all see what I look like. So I someone's like, oh, well, you can't, look like a boy, endometriosis, because I'm not really what people think about when they think about who has endometriosis. And so a lot of times it was just kind of this, like this kind of like, okay, this kind of pull away, like, oh, and you feel that when you're trying to get seen. And my now wife, who is feminine presenting, a lot of times when she accompanies me to the doctor's appointments, they would think she was the one that needed the help around endometriosis. So it's definitely still a lot to shake a stick at. And then some of my hospital experiences, weren't, it was biased there, as I would, later, really admit. But so and then I sunk into a really bad depression, to be honest, just
Hmm.
dealing with all of this and dealing with the lung collapse and then just everything else. So I really went into a depression. I was angry. I shut a lot of people out. But then because I felt like that people weren't there, I didn't get the medical care. And then even people I considered close to me was like, what the, excuse my language, but what in the hell is endometriosis? A lot of people just didn't know, at the time. So at that time, at that specific time, I didn't really know anyone else that looked like me that had endometriosis. Of course, now with endoqueer turned gynoqueer, I would meet so many other people, or so many other people reach out to me and say, I'm also a masculine woman with endometriosis. I'm non-binary. I'm trans with endometriosis. I'm a man with endometriosis. So it was just so many people across, our spectrum that would tell me this. But I started with originally in the form of endoqueer because I didn't want anyone else to feel as alone as I felt. I wanted people to feel a sense of community. And then later on, some of you have noticed the name change to gynoqueer because at first it was we mainly had a focus on endometriosis. However, as more people will come out like you, LaJoya, uterine fibroids, other people, mental health concerns. A lot of people have a lot of other issues, compounding, heading to endometriosis. So I wanted to expand it out, to our queer community overall that's experiencing a plethora of issues, and just for them to know, in fact, that they do have support.
Yeah, yeah. And for reference, can you explain what endometriosis is in your terms?
All right. Well, I know some people may have a different meaning, or some people,
Hmm.
have their different, what do I say? They have their different terms around it. But, and I hope I don't offend anyone,
You're
on
good.
this,
You're
okay,
good. You're
on this
good.
call. 'Cause I know sometimes it's, people have different identities and things, but really it's a tissue. It's usually known as a disorder. Some people say disease, some people say disorder of like the of this tissue that forms outside of the uterus, when normally you have tissue that's lining. And I'm sure that Dr. Shiva may give, a
Hmm.
technical, kind of a technical definition, but it's when it's lining, when they find the tissue is starting to outline outside of the uterus. And that's what I believe. Then it can cause a lot of pain, abnormal periods, and different things for different people. But then, as I found out when I got my diagnosis, a year after my official diagnosis of thoracic endometriosis, is that it can go to the lungs. I've seen studies where people have it in their brains. Some people it goes in their heart. Well, not their heart. So people, it's like
Wow.
endometriosis can kind of affect all parts of the body, and it can also cause just a different variety of issues for a lot of people.
Yeah.
And
Yeah.
usually the tissue goes pretty much where it doesn't belong, where it shouldn't be.
Yeah. Yeah.
Yeah, I like how you
That.
described
Yeah.
that. Yeah, it's endometriosis is one of those conditions that's almost like a jack of all trades type of condition. So it can cause inflammation that can happen all through your body. And that's where a lot of that pain comes from. And like you were mentioning, that tissue that is very similar to the tissue that grows inside the uterus. It can grow outside of the uterus. I've also seen it in rare cases where it has been near the heart and things like that as well. Those are rare, but they happen, right? And it can cause pain because this hormone sensitive tissue will shed, it'll bleed, and there will be no place for it to go. And then that type of stuff will be within the body in areas that the body responds to. Endometriosis is something that can be like on a spectrum. So for some people, their symptoms might be mild, but for other people, it can be quite debilitating, right? Like,
Wow.
having several lung collapses. I think you kind of experience a lot of the other spectrum of things. And a lot of people, unfortunately, with endometriosis go years without a diagnosis, right? So
Mm.
some people may, I think right now, the documented evidence, which I'm sure is underdocumented,
Yeah.
there's a well-known history of at least almost 11 years to time of diagnosis where people come to their doctors saying, oh my gosh, I'm having this pain with my
Yeah.
periods, and they're saying, oh, it's normal, right? And they kind of get
Pretty
shooed
much.
away for years, right? And dismissed. And I think that that's why your organization, like GynoCare, is incredibly important. Having this conversation through this platform is also incredibly important so that people know that they're not alone, and they know that there are options out there for support and for treatment as well.
Thank you. Thank you. Thank you. Um, so Dr. Shiva, I have uterine fibroids and I know a lot of people have heard about it, but I would like to hear from you, a professional, to describe what uterine fibroids are and how it
Yeah,
affects our body.
of course, of course. So uterine fibroids are essentially an abnormal growth of uterine tissue. So it's considered a benign tumor, meaning that this abnormal growth of tissue is unlikely to invade into other parts of the body. However, it certainly is not benign in the sense that you have no symptoms, right? A
Mm,
lot of people may not have symptoms, but a lot of people do. It can be associated with a lot of problems, including things like heavy bleeding with periods, long periods. For some people, the bleeding could be so severe they may need blood transfusions and things of that nature, and not have enough energy to go about their day to day because of things like severe anemia. For other people, symptoms could be because of the bulk of the fibroids being so large, or having so many of them. The fibroids can press on nearby structures like the bladder, where you could have issues with peeing, or even the bowel or the rectum, where you could have things like chronic constipation that can be associated with fibroids as well. So, although this condition isn't considered cancer, it certainly can affect your quality of life pretty significantly. So a lot of people want to seek out different type of treatment options. So I think the main thing that I always like to convey is that there are many different options, right? And sometimes you may try more than one to find what fits best for you. And it's not a condition where there's, one recipe of treatment for everyone. So knowing that you have options and talking to your provider about all those options is incredibly important.
Thank you. And PCOS.
Yeah, so yeah, PCOS. I know, right? Everyone, that's another hot topic kind of in the field
Yes.
of obstetrics and gynecology. Yes. So with PCOS, that's polycystic ovarian syndrome. This is a condition where essentially a lot of hormone imbalances are happening, which affect ovulation. So the normal cycle of hormones kind of going up and coming down, which help you get your regular menstrual cycle, are not happening because of some type of hormonal interference. It's associated with having a lot of cysts in the ovaries because with polycystic ovarian syndrome, you may not ovulate every month. So these cysts, these follicles kind of hang out in the ovary for a period of time. And essentially, you'll see those changes or maybe absence of menstrual cycles as well. A lot of people talk about PCOS in the setting of fertility or infertility as well. So it's something that making sure you get that treated and addressed can help to improve chances of infertility. But I always like to say, just because you have PCOS does not mean that you
Exactly.
cannot conceive, right? There are certainly medications, there are treatment options to make that possible as well.
Exactly. Thank you. I don't mean to put you in a hot seat, but you are the expert.
Yeah.
It's no worries, no problem at all.
So next I want to talk about biases and things that we have experienced within the medical system. So what common forms of biases have you witnessed or experienced in the OBGYN setting towards Black queer women and non-binary individuals? And I know, Dr. Sheba, for you it may be different, but you have probably experienced these things as well. So yeah, yeah, yeah. Whoever wants to
Absolutely.
go.
Okay. I can go. Absolutely. I think now, and for everybody who watches the news, right, we see that there is an intentional attack on diversity, equity, and inclusion. And, when you see things like that happening, you have to wonder why. Like, why do
Mhm.
people go out of their way to backtrack addressing these issues? And I think it's because we've made a lot of progress in being able to name, almost like naming and shaming, that these things are happening. So I think in a way we have moved forward with moving past people being intentionally ignorant to addressing the hardship that other people are facing, because it wasn't too long ago that people used to say, oh, everyone gets treated the same, but we know
Mhm.
that is not true. um, as a provider and as a Black immigrant woman, queer person, I have seen things from, full both sides of the spectrum. I think when you are a person who is has identities that sit on these intersections, you have no choice but to relate with all type of people, right? And in a way, I almost think it's like a superpower. But
Mhm.
with that, it does also come with, the burden of knowing these things are happening. So what are you going to do about it? And I think that's where me using my field and my profession come into hand. In my training, I've seen biases happen. I've worked with trans patients where I've seen people intentionally misgender them, right? And these are things that people do, not even like a lot of people like to say the type of bias that is unintentional, right? But sometimes people do it intentionally just to be mean,
Mhm.
and you'll be
Mhm.
surprised that that even happens in a profession where people should not do that, but it does. And with that, you have a choice of what you want to do about it. So are you going to be like me and say, actually, she says XYZ and correct people?
Mhm.
Or do you stay quiet and allow it to continue to happen, whether the person is asleep for surgery or they're awake and in their face, right?
Yeah.
So absolutely, biases happen in more than one way. But that's just a little taste of it. But there's certainly a lot of biases that are still out there.
Yeah. Yeah.
And Dr. Shiva, I just want to commend you and so many other medical professionals that are committed to doing the right thing, because
Yes.
I can't express enough of how much I've been on the other side of that bias where I've been misgendered. I've been like doctors have not wanted, they weren't comfortable with treating me. Some have said I was too angry when, of course, a lot of things I went through was just incredibly shocking. Um, the issues were, stereotypes were brought up. Like, I'll never forget when I had my first lung collapse and I was brought in by ambulance because originally I started out at the urgent care because
Mm,
at the time I was still a heavy cigarette smoker. So I was thinking, okay, years of smoking, it caught up with me. Years of just smoking caught up with me. But when they wheeled me into the hospital, the medical professionals were all like, "Did you have too many blunt wraps? Did you have too many? Did you have too many hits from the bong? Did you have too many fillies?" This was literally being said to me, and I'm at that point, I'm just in a state of shock of just what happened. Like to hear it
mhm.
urgent care, like, okay, you've had an 80% lung collapse. We're putting you in an ambulance, and so to get that kind of treatment when I go to the
Wow.
going to the hospital, it just really sucked. And then I was, like I said, after the first lung collapse, sadly, I was kind of getting used to them. But that first time was just so shocking because other than an issue where I had to go to the ER because I had a piece of metal, a little speck of metal in my eye back in like the early 2000s, I never really had nothing major happen, so it was just the whole trip. So I was just very shocked. So I was in the hospital for nearly 2 weeks with my first lung collapse. And I'll never forget, I was anxious because they kept pushing my surgery back. Of course, as some of you know, sometimes you have to fast before your surgery happens. So I was going like a while without eating. So of course I was hangry. I was just like, what in the world's going on? And so I would hear them outside of my room, my hospital door saying, "Put her on Xanax. She's hysterical. Put her on Xanax." So this really happened. And then of course I know it, and I know you all can kind of attest to this in your professional fields and the medical world, but I've dealt with this issue with decent, great insurance. But I've also, going back to before I even realized I had endometriosis, it was times I was dealing with this issue, my journey on Medicaid with no insurance, being on the state's marketplace. So I have noticed a different treatment depending on what insurance I've had. Like recently I went to get a checkup, and it was something else the doctor wanted to do, and I could hear them outside of the doctor door like, "Her insurance is good, she has good insurance, you can add that, you can do the extra x-ray." But I'm like, okay, and I'm to myself, I'm just like, okay, well, and I asked them when they came in, I said, "I did hear you all outside of the door." I said, "What if I didn't have this good insurance?"
Exactly.
What I said, because I've been, it makes me sometimes, I have to admit, after all these years I still get angry because I
Yeah.
think about, I'm like, okay, well, the years that I was dealing with this with no insurance, the years I was dealing with this on Medicaid or on my state's marketplace, how much what care did I not receive because I did not have the right insurance. So I
Mhm.
mean, so I have noticed like insurance bias. I, like I said, I've been misgendered even after myself and my wife have corrected doctors, and they were still, they were still determined to say what they wanted to say. And of course, complaints were filed. And then another thing recently was I changed day jobs. So I recently changed insurances. So I have I use estrogen and I use testosterone because of, I had a hysterectomy about 2 years ago because my endometriosis was just ravaging my body. And for me, I'm a proud auntie, but I was like, children for me wasn't a priority. So I went on ahead and
Mhm.
had the hysterectomy, and that was a journey within itself. But I am taking estrogen and testosterone to balance out those hormones, that I no longer have. And the first doctor I saw online did not want, under this specific provider, did not want to get prescribed the tea, and I said I've been using it for my, because I had a hysterectomy 2 years ago, and I am balancing out my hormones. And so I
Mhm.
have noticed sometimes they just want to put me on more estrogen when it's like, no, I know I've had too much of that, and I only have, a small amount that I use, but I still need that testosterone, to kind of balance things out. But I think, but what I've realized, and especially in the medical world, there's still a stigma on gender affirming treatments, hormonal therapy. People automatically think, one thing. And I was like, well, even if it was what I think you're getting at, what's the
Mhm.
problem? What's the problem with
Exactly.
that? And I had one doctor I had to complain about because she was literally like, oh, good, you're taking testosterone for your hysterectomy. And, it sounds like not because, of transition. I said, no, I'm not transitioning, but even if I was,
What's the problem?
that, yeah, what's the problem? That's not, this it's my body, my choice. So I have noticed, like, it's been, I've had to switch doctors just over trying to get, the right hormonal therapy. And also just people, time you come into a facility, like before I was diagnosed with endometriosis, my periods were horrible from the time I first started getting periods. My periods
Mhm.
used to be so bad. Sometimes I'd have to stay home from school. I would be crawling around in one of my old apartments. It was just bad. And I would vomit. Like it was really bad. And so I went to the emergency room once, and I'll never forget. It was like, oh, are you sure how is your sexual activity? Who are your sexual partners? And I could hear them saying, just screen her for all the STDs, when I'm telling you what was going on at that specific time. I had just one sexual partner with the woman I was with at that specific time of my life. But
Mhm.
it was just all these assumptions being made. And I mean, so sometimes even just coming in, people have their perceptions of you, depending on, and also depending on the area that the hospital is in.
That
That
part.
also causes, a big difference. Sometimes, I mean, I'm here in DC, and it's been times where I went to certain other ERs because I know it would be better care than other ERs. And I know it's like that across the country, sadly. But, it's just sad where we are. So yeah, it's medical bias across the board. And another thing I want to say is, I know sometimes as just as black people overall, we want to harp on race, but I will say, and I know sometimes this isn't, a lot of people don't like when I say this, but some of the worst treatment I've received have been from other black doctors because as a people, as black people overall, we vote blue in the voting box, but we tend to still be very socially conservative, very religiously conservative. And
Mhm.
that shows out, and that shows out in your day-to-day life. So it has been times where I've had to, and I'm not trying to put certain people on a pedestal and knock us as a people down, but that has been the realities, especially when you at our intersections of being lesbians,
Mhm.
or however you identify, throughout in the community. So those are just some medical, my perspective.
Yeah, yeah. Dr. Shiva, did you want to elaborate or say anything? Add on to
Yeah,
that?
definitely. I think I think one of the things, if anyone took away, lots of takeaways, first of all, from what
Yeah,
you just
yeah.
shared, right? But I think a really big takeaway that you mentioned that I also really agree with is, if you find that you are in a care facility that is not serving you well, right? Like you don't feel satisfied with the care that you get, or you know that there's a certain standard of care that you've received elsewhere, it's within your prerogative to always get a second opinion. It's within your
Mhm.
prerogative to always to have another care team as well. I always like to encourage people, like, you're not stuck with one
Mm-mm.
person, right? And it's true, not all providers are the same, and sometimes it's almost like, kissing a couple frogs before you find out which one will be the best one. And unfortunately, you can't always tell just by looking at someone's picture on a
Mhm.
website or looking at their name, as you mentioned, right? Because there might be more to people than it's pretty much just not judging the book by its cover. So sometimes you might get in there and you find like, wait a minute, this care does not feel complete, right? Or this care does not feel like what I want. And you are not stuck with that provider. And I think a lot of times I see that people may go to that first stop and it didn't work out well. So then they go home at that point and never make their way back to a healthcare facility. And then ultimately, what that means is that their care and their health will be the one that suffers. So I
Mhm.
always like to encourage people, if someone gives you advice and you're like, I don't think I agree with that advice, or someone gives you a treatment regimen that you're like, I don't think I'm as comfortable with that, and they don't offer you alternatives that you are more comfortable with, that getting your second opinion, sometimes even a third opinion,
Mhm.
is absolutely the way to go, to find a provider that you feel is going to be able to collaborate with you, because it should feel like a
A
team, right?
team.
You, your doctor, your nurses, they should all be teams. You guys are all on the same team. It shouldn't be, the style of someone telling you what you're going to do, right? And you have to like accept it, but it should be a dynamic. Here are my concerns with this. Either they can provide you some answers or some questions to those concerns, or maybe we take a different route. So I always like to encourage people to get that second opinion, get that third opinion, as many opinions that's needed to get what you feel you deserve, and a treatment plan that is satisfactory for you.
Yes. Thank you. Thank you. Um, I wanted to speak personally about myself. I have uterine fibroids. I've had uterine fibroids that I found out about like maybe 2016. I was diagnosed. And so I looked up like the causes and estrogen and hormones and stuff like that. I became natural at in 2016 because they said they're relaxers and could be an issue for fibroids and all the things. And it's just like, for me personally, I wanted to get to know what it actually was, how it actually affected my body, because I had to have um like my energy was so low I couldn't go to work. Like the periods were so heavy I had to stay home. And that costs a lot of money to have to, stay home, get a whole bunch of pads and all that stuff. And you have to realize that you are your own best advocate. If you're not
Absolutely.
advocating for yourself, then we have a problem. You have to advocate for yourself. So look for the doctors that, and personally, I gravitate towards Black female doctors. I always have, always will, but I've also had issues with Black female doctors who look at my weight and automatically assume certain things. No, boo boo, it's not that. It's not. We've already had that checked. It's not that. so, so there's things that you have to realize that there are some stereotypes even within our own race, even with our own gender, that you have to realize that, maybe this person isn't a good fit for you, and that's okay. But do not go home and not find another doctor. Do
Absolutely.
not go home and feel bad about yourself. Just say this wasn't a good fit. Like you take medicine. Doesn't always work for the same people as it does for you. That's okay. Change the medicine. So I think we have to be, and I work for United Healthcare. So as someone who works for the insurance company, I know that there are so many biases out there. There's so many things that we deal with as a race of people, a gender of people, and as a sexuality. So we have to make sure that we, number one, know our health insurance benefits. Please know your benefits. If you need help with that, please reach out to me. I don't care if you have Blue Cross Blue Shield, United Care. I don't care if you have a Medicaid. I don't care, because you don't realize that you have more benefits than you think, and they're not going to tell you this. HR don't know because HR doesn't have the time to tell you. You have to research within yourself or find an advocate for yourself. If you don't know what questions to ask these doctors, ask me. I'll find it out for you. Dr. Sheba will help you. Les will help you. We'll help you. We want everybody to feel affirmed. That's what this conversation is about, for us to talk about all the things. And if you don't feel comfortable talking about these things, reach out to me and I'll reach out to the resources that I have that will help you, because we have to be more involved with our healthcare. If we're not involved with our healthcare, that's how we lose. And there's enough of us losing out here that we don't need to add on to that. So be an advocate for yourself. And if you don't have the support that you need, that's fine. Reach out to somebody, reach out to me.
Absolutely.
But know your health insurance benefits. Know that if the doctor that you have not sitting right with you and not and just rushing you out the door, and it's another copay that you got to pay that other copay to a doctor that's going to help you. It's
Mm-hmm.
okay. And if you need to make a complaint, don't just make it with that medical provider, make it with your insurance as well, because the insurance companies don't know that they're bad doctors if someone doesn't complain about them. And be specific as
Absolutely.
well when you make these grievances. It's very important, because they don't know if you don't tell them. So the medical practice may not even know. I mean, they probably do because they get more phone calls than the insurance company, but still, your voice matters, your complaints matter, and do not sit at home stressed out because you had a bad doctor's appointment. Say, okay, well, forget them, on to the next, and find another doctor. Just like you don't have to stay in a bad relationship, you don't have to stay in a bad with a bad doctor.
Absolutely.
Please understand that. Sorry for my rant. Okay.
And I just wanted to add one thing. No,
Yeah, yeah,
everything that
yeah.
LaJoya said, everything Dr. Sheba said. Because one other thing I usually get is people say, "Oh, that's great what y'all are saying, but I don't have insurance, or I can only go to this one specific public clinic." Trust me, I've been
Me
there.
too.
But but
Yeah.
as mentioned, like LaJoya said, you can reach out to her, you can reach out to Dr. Sheba, you can even reach out to myself. And even myself, I tell people, even if I don't have to answer, I will direct you to somebody, who can.
Mm-hmm.
The thing is, like she said, name what you need, voice what you need. Please do not stay quiet. Reach out to somebody. And even if that somebody doesn't have exactly what you're looking for, chances are they can at least direct you to a
Amen.
resource.
Exactly. 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 Don't ever let your inability to have health care stop you from getting the health care that you need. I've had Medicaid. I've had no insurance. I actually had um I found out I had fibroids when I had Medicaid. So it's not always about having quote unquote bad insurance. It's about having a bad provider who's
Mhm.
not giving you the test that you need, and you have to voice your opinion on that. And if you don't, you're going to end up losing. You're going to be at the house not finding out what's wrong, when you could have just had a test by the correct physician who could have told you what's really going on and you could feel better. So regardless of what insurance you have, you can get quality health care. Is it harder if you have Medicaid? Yes, but it's not impossible, and we can help you find that information. So yeah, yeah. um all right. uh this kind of goes to what we were already talking about, but I do want to let's do this one. What changes need to happen in the medical education to address the biases and erase queer and trans experiences? This is not just to Dr. Sheba. This Les, you can take that as well, and that's also Dr. Sheba. You can talk about that as well. What would you all like to see different um, in medical education with our
Yeah.
community?
Medical education for like providers or for community?
Both.
Both. Okay. So
Yeah, yeah.
medical education for providers, I will say a lot of medical schools actually have started to recognize that there are significant health disparities. Like we've known about this, we know about disparities in outcomes. And there have been big waves and now published data, now naming it, saying, hey, these issues are not due to race or insert your minority group here. It's due to the isms, right? The
Mm-hmm.
racism, the sexism, right? The misogynism, right? Those are really the issues. It's our biases that are leading to these outcomes, right? And then it becomes a cycle. And a lot of schools have actually become intentional to say, hey, we need to teach the next generation of doctors, nurses, healthcare professionals about these because, unfortunately, as you see me here, I'm part of the 2% of doctors who happen to be Black and female. So 2% out of 100 people look like me have had similar experiences. About 5% if you include the male counterparts. So we're 5% out of 100. We on ourselves cannot individually be able to share our information with everyone. So medical schools have become intentional to bring this into the curriculum when training the remaining 95% of our cohorts about experiences of people that some people have never interacted with in their life. It's kind of
Mm-hmm.
hard to think in 2024 that certain racial groups have never mixed, but it's true. I don't know
Mm-hmm.
if you guys know, but even our social media is segregated. You know,
Mm-hmm.
your Instagram, your TikTok looks very
Yep.
different from somebody who doesn't happen to be, a Black person, right?
Mm-hmm.
I didn't know that. I learned that probably within the last couple years. So not only are we segregated in our communities, but we're even segregated digitally as well. So making sure that you have intentional education happen is important because some people may never have that exposure until they become your doctor. And I think that's not really the greatest time to learn about diversity when you're actively trying to practice medicine. It's good to be
That part.
prepared beforehand. Now,
Yeah.
I will say, unfortunately, I keep on talking about the latest news. That seems to be
Mm-hmm.
my trending topic. But
No, that's fine.
unfortunately,
Yeah.
because a lot of public institutions receive federal funding, there has been an intentional pull by our current administration to actually remove funding from these public universities unless they remove diversity, equity, and inclusion
Mm-hmm.
out of their curriculum. How horrible is that?
Mm-hmm.
It's horrible. So there is an intentional perpetuation to keep people ignorant, which I think
Yep.
is going to be even more problematic in the future when it comes to healthcare and healthcare disparities. So, with that, going past the med student level, some residency programs also have made again an intentional education to try and educate the now doctors who are learning how to become doctors about diversity and the importance of recognizing that, confronting your biases, and trying to be intentional about doing the work to provide people with equitable care. Right
Mm-hmm.
now, from the community standpoint, I think the education with organizations such as Les's organization or such as my program as well, are really amazing. Honestly, life changing. In the OB space, we've learned that for people who identify as Black pregnant women, having the support coaching of a doula during
Mm-hmm.
their pregnancy has helped them to have significantly improved outcomes when it comes to experiencing things like birth traumas that can happen. So the support of having a doula, having that education about pregnancy has helped to reduce birth related traumas, right? So I think
Mm-hmm.
that in the same respect, that will apply for things like endo, fibroids, other GYN issues. When people have a support group or even a support coach, someone who can advocate for them, someone who can help them to fill some of those holes that that occur when you walk out of that 10-minute doctor's appointment. I
Yeah.
think it can, be life changing. Absolutely.
Yeah. Thank you. Thank you.
And yeah, everything that Dr. Shiva just said, and like she said, it's so important. It's so many prongs to this, but I'm gonna try to give the most brief answer that I can. But the first I'll address like medical professionals, as she mentioned earlier on this call. It is important to be, especially when you are a professional, when you're someone that patients are depending on, it is important to be an advocate, not just, maybe online, or you may say something, but when you're in the clinic, when you're on those online appointments, I've had some
Mhm.
professionals sometimes say, God, it was so messed up how what the doctor said, and I said, why are you telling me right now? Why didn't you say that in front of the damn doctor? I mean, it's so it's important to be, as you all mentioned, be an advocate and be supportive
Mhm.
there. It's important for, continued education, because when a lot of people still think of reproductive justice, despite all of the education that's out here, they still think of kind of their typical, it goes beyond like abortion, it goes beyond just your standard pregnancy, and it goes beyond specific blood parenting. It's so
Mhm.
many prongs to this. It's about the right to what family is to our community. It's so many people, it's many people that are watching now and that will watch this, where your queer parents, some people, may have adopted, some people may be in their pregnancy journey, some people may
Mhm.
be on their own health journey, some people may, be going through life with just chosen family, as so many of us in the queer community, do. So it's
Mhm.
just so many different lenses to reproductive justice. And it's also about the medical professionals understanding the importance of our community still having autonomy over our bodies. As we're seeing now, the current political climate, so much is at stake. So much federal funding is being ripped, and so, like she said, we've all seen it. Oh, we're
Mhm.
ripping this federal funding if you don't, take out DEI, or oh, you got to quit with this gender affirming care for children, or we're gonna rip your funding away if you don't. So a lot of times, especially over the LGBTQIA plus community, a lot of professionals and political people try to have say over our bodies, like, oh no, you don't need to, do this, or you don't need that gender affirming care, or oh, are you sure? Oh, that child can't be lesbian. Oh, it's just so many, things that people try to take away our autonomy with. And so it is so important for that education to happen, despite what these rollbacks that are happening in our country right now. It's still important for health professionals to have the courage to be like, okay, this is how we can still help with with this this education. We know that there's there's drawbacks. We know that not everything we've learned has always been correct, and we
Mhm.
have these communities that we still have to serve. This is how we're going to best serve them. And then on the community side, we and I definitely want to say this, especially on this call,
Mhm.
as we're black educated lesbians,
Mhm.
so it's important for us to act like that, and not and not actually, and not divide ourselves more. What I've seen is so much intra level issues within our community. Like, okay, the L's and the G's don't like the B's and the T's, or oh no, oh queer, oh that's something else. Oh, I'm an old school lesbian. We don't do that. Oh, I don't know. And excuse my language, but I don't know what these new studs and D words are doing these days. So it's just so much, division, that sometimes we're lesbian, but we're not like what you're seeing on social media. And so when that happens, we're kind of dividing ourselves. Like, I've even had some people tell me, I'm a lesbian and I'm going through endometriosis, but I ain't going through all that. I ain't saying all what you're saying. So it's just so much, division. And I'm 40, and so sometimes, yeah, so it's a lot of things that younger queer people have had to, teach me, and things that I've been educating myself about. And and then vice versa. I think it's important for us, being, older, to be there for our queer youth, as well.
Mhm.
So when we're like, oh well, I don't believe in mutual aid. Oh well, they just need to get themselves together. Or, and sometimes it can be very gendered in our space, like, oh well, why don't that stud have good insurance? Is she working? What's going on? Or if a femme comes in there, or that stud's not taking care of you. So sometimes, unfortunately, we've we've become very gendered ourselves, and that also stops
Hmm.
us from being able to really all of us joining as a community. And that's why I said I know that a lot of times we like to finger wag a lot of straight people, but sometimes we have to step
And
back.
be our own people.
Right. And like, what can we do? And that's what's we see these rollbacks are happening. So it's important for us to stick together more than ever. Like some things like she said, doula care, community-based care, wellness around Reiki, other ways of people being able to access, community-centered care, trauma responses, like how can we be there for each other? Okay, mutual aid. Okay, these people, because they're living their truth, they lost their sources of income.
Hmm.
What about the mutual aid? Are we going to get together and be like, okay, this is how we can help, this portion of our community that's struggling? Or are we going to be like, oh, well, they did that to themselves, or, oh, well, I'm gay. I'm not going through all that. I'm doing all right. They're just doing whatever. They're just wrong. So we really have to come together as a community, especially right now.
Now.
We may not
Yep.
have, the federal funding that a lot of us have been depending on in the past. It's like, okay, the system isn't working now for us. The system isn't tilted in our favor anymore. What are we going to do now? Are we just going to fight with each other or
Exactly.
bicker on the internet? Or are we going to be like, okay, we need to get into our community based care? Because although we have Dr. Shiva and so many affirming people in the medical field, it's like, okay, Dr. Shiva can't be there, for us at
Yeah, she
2 in
can't
the
be there for everybody.
Right. So it's like we gotta really pull our resources together and not bash people when they put up GoFundMe's, bash people, that need mutual aid. And for the whole community, everyone to understand it's not all of us whining or crying or always trying to extort money out of people. It's because, okay, we need it. Do you think the
Hmm.
community would be coming online like this if they didn't need it? No, we need support. And many people in the queer community overall don't have blood family, for
Hmm.
whatever bias, whatever reason. So a lot of us have chosen family. We A lot of us have chosen family. So we have to rely on the community a lot more than what maybe the straight people or other people, have. So I definitely on this program today, I definitely wanted to express the need for community-based solutions in conjunction with, us navigating our healthcare system during times like this.
Thank you. Thank you. That was everything. That was everything. Thank you. Dr. Shiva, did you want to say something?
No, that was beautifully put. I think you hit all the points with that one.
Yes, yes. And Dr. Shiva mentioned that she is 2%. A black woman in OBGYN is 2%
Yeah, in all of medicine.
in all of medicine.
Our black women
She did
doctors,
not she did
2%.
not add on queer. So if she would have added
Oh,
on queer,
that's probably like 0.2%, maybe.
that part, that part. So we have to make sure that we encourage all of our friends in the medical field to keep going, to keep doing what they're doing. Because when I saw her and I introduced myself to her, I was like ecstatic. When I when I found her, I was like, oh my God, like, wait, what? You exist? There's people like you? Like, I had no idea. Like, I was hoping that would be great. Yes. But it's hard to find. And so community is needed more now than ever. That I
Absolutely.
mean, I founded BEL in 2014 because I wanted professional people to talk about professional things and for us to have collaboration and sisterhood. Because unfortunately, Black women, we can be very divisive. And I wanted our community to have a space where we can talk about things like this because it affects us all of us in different ways. And so when we can come together and have a collaboration, what the federal government is doing, they're going to do. But
Hmm.
if you have a strong network, if you have a strong community, you ain't got to worry about what they're doing. They going to do it anyway.
It's
So
true.
it's up to you to to find your community, to find your family. So when they doing whatever they doing, you don't have to worry about it. Is that easier
Definitely.
said than done? Of course, it's easier said than done. But once you have a community and a sisterhood of people that can give you the information that you need, that's all. That's all that matters. That's all that
Absolutely.
matters. And so that's why these conversations are so important. Um, so yeah, I have one more question, and then I'm going to go to the audience. And then we can, you all can ask questions if you would like. But my last question is, and it may be one of their questions, what advice do you have for Black queer women who are experiencing nervousness and fear about visiting the OBGYN?
That's a good one. You're about to go first, Les. You got it.
Okay, so one thing I would recommend, because it's definitely also a difference when you go to these appointments and have to
And your
navigate
mask.
certain things alone. Yeah, and
Hmm.
navigate certain things alone. So what I would like to always recommend to people is to bring, if you can, bring a loved one or a advocate in some
Hmm.
way. And if not possible, I know it's times I've had my wife and others on FaceTime.
That
First
part.
you want to ask the doctor like, "Hey, my wife or my friend or my cousin or whoever it is couldn't, or my advocate couldn't be here in person. Can I turn on my FaceTime?" And my experiences, they have said yes. That
Hmm.
way that person is still there. So that's something, that I've recommended. Or if you don't have FaceTime, maybe adding putting them on speakerphone so they can hear the appointment and ask questions, if they need to. So that's one thing to do. Or again, you can reach out to any one of us, if you have questions prior to trying to go to an appointment, or what advice do you have, or if there's someone, even if it's just a friend, like, hey, can you come with me to the doctor, or maybe an advocate or a counselor, or they can help. And then there's other like community based collectives that can also provide safe spaces for you to ask this, things like people like Queer Care, and then various queer birth workers and doulas, and then it's different LGBTQIA plus clinics and pop-ups that do happen in communities across the country. There are on our site, and we're building, we're adding more resources, but there are some resources there to help. And then again, and you can also reach out to your local queer, if you have this, where you live, your local LGBTQIA plus, community center. And although they may not have that activity or whatever, they can point you at least to that, to that specific resource. So I know a lot of times we always like to just think about our national organizations because that's what a
Hmm.
lot of people know, but there are smaller collectives that are online in case you don't have access to in person, in
Hmm.
person community, or vice versa. You can, it's some at like pop-ups that happen in person, or LGBTQI friendly clinics, depending on where you live, where that can happen. But you don't have to do this alone. And if you're scared, if you're nervous, I have people that reach out to me all the time like, hey, I think I have
Hmm.
endometriosis, or hey, I had someone reach out to me not long ago, hey, I had my lung collapse, like, what do I do? And they're freaking out. So
Hmm.
I don't mind people messaging me, or, and like I said, if I don't have the answer, I'll direct you to somebody or a collective who can. And so that's my thing. You're not alone, and I understand, because with, especially with our community already being black, we're usually, there's this stigma. Then you add, so you're getting all that, racism, as Dr. Shiva mentioned, those isms. But then, okay, if you're a woman, sexism. But then, of course, if you're, when you're queer, then that's like, sometimes like, okay, the race, now you don't have like a good part of, the race here for you, because of their, their isms. Then, okay, if you're not lesbian, gay or lesbian, that, because some of the greater society has accepted that, but then if you're like, okay, I'm bisexual, I'm trans, I'm queer, then something, then it's like, then you may not even have some of the queer community, because now
Mhm.
you're B or T or or Q, you're all these other, you're these kind of other letters, so so it's just, that's why it's always just so important, to realize, you don't want to shut anyone out, or it can be easy to shut down. And like you all said earlier, if you have sometimes one bad appointment because of all the trauma that has already been
Mhm.
experienced in one's past, that one appointment could be the straw that breaks the
Yep.
camel's back. Like, you know what, F this. I'm just going to let nature take its course. I've heard that
Yeah.
a lot before I realized what was available to me. For a while, I was even like, you know what, my life's been hard enough. Now to add this, you know what,
Mhm.
Jesus take the wheel. But luckily, well, and I'm personally, I'm a believer. If you're not, that's fine. But for me, luckily, I was, spirit led me to resources and people.
Mhm.
But just know you are not alone. You can reach out to us. There are
Mhm.
collectives. You can always, reach out to us for that. And I would like to give a shout out to LaJoya for inviting us and for creating Black educated lesbians. I can still remember
Thank you.
a couple years ago when I was watching the BET Awards and I saw the commercial and I was like, oh my God. And I went on the Facebook group. So it was history, after that. And then, for instance, Dr. Sheba, who, you can reach out to her, and, she's very refreshing, just, with
No,
knowing,
thank
okay,
you.
there are still great people in the medical system.
Yes.
Definitely. And I think I also like to add that, having anxiety when it comes to the healthcare field is very valid, right? Not that validation is needed for someone to give to you, but know that you're feeling these ways because of experiences you've had, experiences of your loved ones that have affected you. So you having these feelings is, it's nothing wrong with you. This is a response, right, to a flawed system. I like to, when I'm coaching people on how to better engage with the healthcare system, be able to help talk to them about how to talk about what they're feeling. When you talk about conditions like endometriosis, sometimes even severe fibroids, these are conditions people have dealt with for years, right?
Mhm.
So you have all this information about how you feel, but you have this, 10-minute, 15-minute appointment. So being able to figure out how best to describe your symptoms, putting together your timeline of maybe the progression of the symptoms, trying to put together some of the previous treatments you may have attempted that may have worked or not worked well, and gathering all those thoughts with you, writing them down so that when you get to your appointment, you have all those informations down and the anxiety and the fear and the time isn't affecting you from really telling your story. And then I always say to come to your appointment with questions, right? And writing those down as well is really helpful because, again, in the heat of the moment, as things are moving around, it could be hard to just memorize those things. And then, of course, bringing your pen and pad with you to write down those responses. I love Les's suggestion of having a trusted family friend come with you, or if they're not able to be there in person, to have them on the phone. Because I think that also gives you some strength when you know your support is, on the other side of the line or they're in the room with you as well. And sometimes they can also help to portray your story for you if sometimes the nerves can kind of make you get a little bit frazzled in that moment. And then again, trusting your instinct, right? So when you're in your appointment, seeing how that provider makes you feel. Although you came there with anxiety, did you leave with that same level of anxiety? Because if that
Mhm.
anxiety went down or went away, maybe that's a sign that that's a good provider for you.
Mhm.
If that anxiety was worse and escalated, maybe that's a sign as well that you may want to consider another provider. Because when it comes to practicing medicine, it's important that not only are you getting the treatment that you need, but also you want to know that you feel satisfied with your care, because that also has a big impact at how you do overall in your outcome. So there's people like oh my gosh, Les mentioned so many amazing community organizations. There's also health coaching support. So, like things like what I do. So, I don't provide medical advice and write you prescriptions, but I certainly can help you to put together your package advantage so that when you do get to the hospital, you'll feel more prepared. And there are a lot of different people who do work within this space as well to help to support you.
Yes, yes, yes. Thank you, thank you, thank you. I do want to say, treat every doctor's appointment, especially every first doctor's appointment, like a job interview. They're coming to ask you questions, you're coming to ask them questions. And if it doesn't feel like a good fit, that's how you know whether or not you can continue to give them the most your most personal information to you, so you can feel comfortable with them. If you don't feel comfortable with them within that first meeting, it's time for you to find someone else. Also, if you're a little iffy on it, wait and see how the office responds to after you to get your labs done. How fast do they respond to you with these results? Because honestly, I have my chart and I use my chart very well. So if I'll get the results, and if I don't hear from my doctor for like a month, girl, what happened? What happened? I already know the results because they review the results as soon as they put it on my chart. But I haven't heard from my doctor. So why is that? So there are times when you just have to treat them like a job interview and have the questions. Have If you don't know what questions to ask, the three of us are here. We can guide you through that information. But don't feel. I do understand feeling anxious because I have social anxiety and I have depression as well. So I understand. And plus, big. I'm big, so people automatically assume, oh, it's because of your weight, because your weight. You got bad skin because of your weight. Your eye hurt because your weight. Okay, you got a headache, your weight. All right. So I I understand more than anybody, but I'm still going to these doctor's appointments because these doctor's appointments are needed. Plus, I have health insurance, and even if I didn't, everybody needs to have medical attention. Everyone does, regardless of the type of insurance you have. Make sure you check yourself out. At least have an annual checkup. At least do that. Even if you don't like going to the doctor, please do it at least once a year. Um, get your eyes checked. Go to the dentist. All that stuff is very important. Um, so yeah, I do get being nervous, but also the tips that they mention is very helpful. And also, if you have any questions or need anything, just reach out to us. Um, so yeah, I wanted to finish off by seeing if anyone has any questions for our panelists. And if you don't, that's totally okay. I am going to send to everyone who registered, I am going to send out a list of resources and their contact information in case you need to reach out to them in a follow-up email by the end of this week. So if you don't have any questions right now, that's totally fine. I'll send everybody a follow-up email. So yeah, yeah. But does anyone have any questions? Let me check the chat.
I think some comments in the chat. You guys are very
Yeah.
welcome. Thank you guys for coming out. I was happy being
Awesome.
here on the panel.
Awesome, awesome, awesome. Okay, so no questions. That's totally fine. Like I said, I'm going to go ahead and send a follow-up email with everyone's contact information and a list of resources. So if you have any questions, please let me know after you get that email. And it was great talking to you all. Thank you so much.
All
Thank
right.
you, thank you, thank you.
Thank
Y'all
you
have a good
all.
one.
Thank you.
Have a great day,
Bye.
everybody.
Bye.
You too.